Hello. Today I will be presenting an entirely new pathogen, Nachtosis. Nachtosis derives its name from the German word Nacht, which translates to night in English, since the pathogen originates from animals usually found at night. The osis suffix refers to the cell death that occurs when infected with the bacterium. Throughout this presentation, I will outline why Nachtosis would be a unique and highly potent candidate to become a global pandemic, the characteristics of the disease, the strategies that would need to be implemented in order to manage it, and how the surveillance and response to an outbreak of the disease would be conducted to minimize the damage it may cause within the global population. Nachtosis is caused by a mutated neuroinvasive bacterium originating from a zoonotic spillover of the Nachtosis bacteria that occurred in food markets in urban Southeast Asia. The bacteria have a naturally occurring animal reservoir in rodents and bats, as these animals usually reside in the environments where bacteria thrive. The bacteria live on their fur and spread to humans when physical contact is made with the bacteria. Zoonotic transmission was caused by a human handling the remains of an individual carrying the bacteria. The bacteria cause rapid apoptosis, or naturally occurring cell death, in an infected person's brain. This causes confusion, memory loss, seizures, and ultimately leads to organ failure. The bacteria are transmitted through airborne particles and fomite transmission. The incubation period is around 12 days, during which the infected person is contagious. The fatality rate of Nachtosis is around 35%, and the basic reproduction number, or R0, would likely be around 2.1, meaning that for each person infected, they would infect about 2.1 more people. There is no pre-existing immunity within the population, as there is no vaccine or disease that the population has been exposed to before. The disease progresses rather quickly once an infected individual begins to show symptoms of Nachtosis. During days 1 through 3, an individual will experience a mild fever, fatigue, and strong headache. Days 4 through 7, the individual will begin to experience the neurological symptoms of the virus, including memory loss, disorientation, and even seizures in more severe cases. Days 9 through 12, the individual will start to experience organ failure in severe cases, resulting in death. However, if the individual survives their encounter with the bacteria, some of the side effects can be long-lasting. Foggy memory, continued seizures, and loss of fine motor skills are side effects that will be found in most survivors. The bacteria are likely to become an international catastrophe because of where the bacteria originally made their jump from animals to humans. In the more populous cities of Southeast Asia, where it is more difficult to manage waste left behind by different street vendors due to the archipelagic nature of the area, any trash that is not disposed of attracts rodents and bugs, which in turn attract the bats that hunt the bugs at night. This close contact relationship that the humans in the area have with the rodent population is what led to the zoonotic spillover of the bacteria to begin with, as patient 0 was likely someone who was just trying to rid their area of an unappealing sight, i.e. a dead rat or bat. However, once the spillover occurred, the dense urban slums only contributed to the rapid spread of the disease. Since many people are always in such close contact with each other, because the disease has a fairly long incubation period, it was difficult to slow down. Some cultural risks include a large amount of misinformation being spread throughout social media and to the rest of the world about where the disease originated, how it originated, and how to effectively prepare for the disease. Additionally, a stigma may form around individuals who had been previously infected by the bacteria, who show side effects of their encounter with Nachtosis, causing even more emotional and psychological harm in those who had already overcome such a difficult disease. Lastly, many people would not only suffer from the disease, but also the monetary effects. In cases where people must work every day in order to support themselves and their families, an encounter with Nachtosis could result in long-lasting side effects that may make working as they used to extremely difficult, since many of the people of lower socioeconomic standing require some sort of physical labor to make their livings off of. The key factor of disease surveillance must be early detection and early response. By employing methods that put early detection and response at the forefront, it will be possible to slow and eventually stop the spread of Nachtosis. One of the most important objectives of disease surveillance is finding case patients. To do this efficiently, there are a few things that should be done. The development of new technology should be relied upon. All hospitals and clinics that are taking patients should report any neurological cases that come through the door, as it is a strong symptom of Nachtosis. These cases can be reported to an app or website that helps track the spread of the disease, stating locations and number of cases reported in a day, so the spread can be accurately monitored by the population and scientists. Rapid test kits should be designed so that the number of reported cases is more accurate and used on any patient who comes in showing symptoms of the bacterial infection. Newer technology should also be implemented by scanning the internet for searches of symptoms and finding out what area they are coming from, so that the area can better prepare for a possible outbreak. All of these methods will aid in case patient finding and will help increase the chance of finding new cases in a shorter period of time. Another goal of disease surveillance is characterizing the population at risk. By relying on doctors who will be accounting for the number of cases they have encountered that day and encouraging the general public to track the spread in real time, this may help scientists and doctors be more aware of the areas that could possibly contain a breakout of the disease, and helping them identify which groups may be at risk in those areas. Additionally, allowing the public access to information about the disease and its spread, including the number of cases reported and the most affected ages, might encourage early testing and isolation among users. By encouraging this social distancing behavior from the general public, doctors will have greatly aided in slowing the spread of the disease. There are many ways in which Nachtosis can be managed, and one of the ways it will largely be slowed is by developing an antibiotic that will treat the symptoms of the bacterial infection. A second way to manage the spread of the disease can be by implementing strict quarantine rules for those who are infected, enforcing social distancing rules, and implementing mask wearing, similar to how COVID-19 was combated. The disease can be prevented by developing multiple doses of the antibiotic in order to keep immune systems resilient enough against the bacteria and any possible mutations that it may have. The strategy in which an antibiotic is dispersed depends on the international cooperation between governments and scientists to raise the funds, resources, and research necessary in order to create an antibiotic for the virus in a short period of time. By having a measure to counteract the effects of the disease, the treatment will be able to lower the fatality rate of Nachtosis, saving many lives. Lastly, implementing a strict quarantine has worked before with COVID and would work in this case due to how the bacteria spread from person to person. By having governments cooperate in implementing a shutdown, limiting human interaction, the spread of the disease will be significantly slowed, saving even more lives when paired with the development of an antibiotic that counters the effects of the bacteria. The third strategy for management of Nachtosis is distributing and ensuring that a large amount of the population gets multiple rounds and doses of the antibiotics to keep immune systems strong enough to fight back a possible mutation of the bacteria. The first step in ensuring the antibiotics get to the areas they need to get to is to ensure that the governments are cooperating in the shipment and distribution of the antibiotics. By doing this, the richer countries, where the antibiotics will likely be manufactured, can more easily get the antibiotics to less affluent areas like East Africa that would be hotspots for Nachtosis outbreaks. Once communications between governments have been solidified and agreed upon, it is important to inform the communities of less affluent areas that these antibiotics are being sent, that they are safe, and to encourage the local populations to go to the closest center providing the life-saving drugs. In less affluent areas, communicating the locations of the clinics that will be handing out the antibiotics is not as simple as posting on social media. Workers will have to implement a door-to-door strategy, informing locals of how and where to get access to the antibiotics. The third, and likely most difficult step, is distributing the antibiotics to more remote areas where there is less infrastructure. The people in these areas are likely to be farther from centers of distribution and would need more incentive in order to make the possibly long journey in order to get their antibiotics. The communication strategy would be different in a more affluent area like Miami, Florida, where many people have access to their phones and social media. Because of this, news of the dissemination of new antibiotics is easier to spread through simply just posting on social media or working with local news stations to help spread the word on television and in newspapers. Disseminating information to healthcare providers is one of the most important groups, as they are the ones responsible for giving the antibiotics to those in need of them, along with the ones reporting the possible outbreaks of the disease. Virtual webinars, weekly updates that include the number of cases within the area that the health provider practices in, and a schedule of the distribution of antibiotics so that they can treat patients effectively. Distributing the information to more vulnerable populations is key, as young children and the elderly are more susceptible to the symptoms of Nachtosis. Flyers can be placed in places like elderly homes, pediatric clinics, schools, religious spaces, and community centers, accompanied by online information sessions led by health workers and social media videos in different languages to reach a broader audience. Nachtosis will be the new pandemic because of where it suddenly underwent zoonotic transmission, and the world population did not have prior immunity to the bacteria that were spreading around the world. Paired with this is that Nachtosis is extremely contagious and has a long incubation period, during which the symptoms are not yet present. Once the bacteria make their way into more densely populated areas, these factors make it extremely contagious and cause it to spread rapidly through the population. Additionally, even when an antibiotic is created, it will be difficult to completely treat the areas that do not have the infrastructure needed to get the antibiotics there safely, so there will likely still be outbreaks of Nachtosis in those areas, even after the disease has been slowed in more affluent areas that do have the infrastructure necessary in order to get their antibiotics distributed properly. These are my sources. Thank you for listening.